Assalamu alaikum. Today, the topic of my lecture is pericardial effusion and cardiac tamponade. What is pericardial effusion? It is collection of fluid within potential space of serous pericardial sac. And what is cardiac tamponade? It is acute heart failure due to compression of heart by a large or rapidly developing pericardial effusion. Now coming to the clinical features, the first one is heart sounds are soft and distant. The second is epic speed is obscured. Obscured means ambiguous. The third is friction rub, which is the abnormal squeaky sound heard through the stethoscope when two inflamed layers of tissue rub together. The most important sign which we find in pericardial effusion is EWART'S sign. And how EWART'S sign shows is by area of dullness to percussion below angle of left scapula. And why it occurs? It is due to the compression of base of left lung by the effusion. As the effusion worsens, signs of cardiac tamponade become evident. The first sign being cardiogenic shock without pulmonary edema. The second is pulsus paradoxus, which is decrease in systolic blood pressure greater than equal to 10 mmHg during inspiration. In a normal heart, BP tends to fall on inspiration because of septal deviation that occurs. It is normal, which occurs in every individual out there. But if there is cardiac tamponade, that is large amount of fluid around the heart, this fluid outside the heart crushes it and more than normal septal deviation occurs, thus more than normal decrease in the BP. Third is tachypnea. And fourth is BECK'S TRIAD. What BECK'S TRIAD include? It includes increased JVP, hypotension, and distant heart sound. Now coming to the diagnosis. The diagnosis is first made on ECG. What ECG shows? Low voltage QRS complexes and electrical alternance. What is electrical alternance? As the name alternance suggests, QRS complexes alternate in amplitude due to to and fro motion of the heart within the fluid-filled pericardial sac. The second diagnosis is made on the chest X-ray that shows water bottle heart, cardiothoracic ratio increased, and narrow vascular pedicle. The third diagnosis is made on echo. Echo demonstrates the site, size, and presence of effusion and tamponade. Now coming to the management. First of all, we have to treat the underlying cause. Then comes pericardiocentesis, which is of diagnostic value in pericardial effusion, and in cardiac tamponade, it is used to treat the cardiac tamponade by relieving the pressure. Now there are few exceptions that in low pressure cardiac tamponade, as only atria gets crushed, so pulsus paradoxus is absent. Second, in massive pericardial effusion, heart gets used to the fluid, hence pulsus paradoxus is absent. Thank you so much. This was all for this topic. For more information on different topics, kindly visit my channel.